Good afternoon, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID-19 Task Force for the Coastal Bend. Today's February 5th, it's Friday, and we're going to talk about this week's update. The task force has two objectives. One is to address your concerns and questions about COVID-19 and the interventions taking place to combat it. And the second is to help to enable evidence-based decision-making on behalf of our local leaders. There are several COVID-19 interventions that are taking place right now. I want to remind everybody that you can go to nuesisknows.com to look at the risk dashboard. Currently, we're in the highest risk level, which is coded with red and is termed extreme risk. What this means is that there is a high probability of contracting COVID if you go out in public right now. So stay at home if you can. That's the first recommendation. Two, it's a state mandate to have face coverings on in public places as well as social distance. And remember that the federal COVID task force is indicating that wearing two face coverings is better than wearing one. It kind of makes a lot of sense, but with just the surgical masks, they don't fit as well around your face. And by just wearing a cotton mask over top of a surgical mask, you can increase the effectiveness of that to almost N95 levels. There are also KN95 masks, which work fairly well, and we posted on our social media an article in Popular Mechanics, I believe, about that. Isolate when you're exposed or symptomatic. And where we have partial to all remote schooling, depending on where you go around the coastal bend right now. And our businesses are operating at 75% of capacity, with the exception of bars, which are operating at 50% of capacity. And of course, we're rolling out vaccinations nationwide and worldwide at this point to try to get past this pandemic. So a new slide we're going to show you this week is our progress towards vaccinating everybody. So what you're seeing here is a bar graph where we have the percentages of the population that have had at least one vaccine dose across the 12 coastal bend counties. And you can see that a county like Nueces is somewhere between 5 and 10% of the population has had at least one vaccine dose. And for Kennedy, almost 25% of that county has had at least one vaccine dose. For the percent of the population that's fully vaccinated, it's less. Now these are records of people receiving 2 doses, and so in Nueces that cuts the percentage in half. Refugio here for full vaccinations is leading the coastal bend, and as time goes on, we'll watch these numbers increase. So the difference between only having one vaccine dose and 2 vaccine doses is with 2 doses, you're less likely to contract COVID, or at least have a really bad COVID case than if you only have 1 dose, or obviously if you have no doses. But even 1 dose is very effective. 2 weeks after your first dose confers a high degree of protection. Going on to our total number of confirmed cases. These confirmed cases, they're both confirmed by PCR test, or it could be some other test for COVID combined with a medical diagnosis. We're at 39,041 total cases in the coastal bend, with almost 35,000 recoveries. This week, active cases are down 16% over last week. When we reported on this, you can see it in the little downtick in the graph depicting the number of active cases, and hopefully this downwards trend continues. In terms of the transmission rate, we have a small update and adjustment this week compared to last week. We've updated our upper limit to be 0.93, which is below 1. So both our upper and lower limits on our estimation of the transmission rate are below 1. Now, what that means is that COVID is declining if the transmission rate is below 1. Here we are right around here. And literally what the value 1 means is for every person that contracts COVID, they pass it on to 1 more person. So if we're below 1, that means some people don't pass on COVID to another person on average. and that leads to its decline. Here, this dip, we're becoming more sure. I'm saying I'm unsure here, but we're starting to become pretty sure that this dip or drop seems to have coincided with the week before New Year's Day. And we will continue to update the data as the task force gets more and different data that it can analyze. The reason why we're associating this with the week before New Year's is that we got access to new data where we can see the dates that tests were administered, and we were a little bit forward on the, or we weren't accounting for all of the lag that there is between when somebody gets tested and when that test gets reported. So it's maybe about 5 days more lag than we thought that there was. Okay, moving forward. The daily confirmed cases, which are here in black, are, well, it's kind of difficult to tell from this graph with all the scatter. The model, and with the best fit model through that, is showing you that there is indeed a downwards trend in the number of new cases that we're seeing around the coastal bend. We have two scenarios. One is an upper limit scenario, one's a lower limit scenario. Both of these are equally likely given the data that we have right now. And so we're showing you both. And as things develop, we'll update you again. Sometimes things change. Right now we're trending downwards. This could change and turn upwards again. That's hard to predict when something like that's going to happen, when nothing else is really changing. We're not seeing any changes in the regulations in the coastal bend that would trigger a change in transmission. So the cases are decreasing. When we break this down by county, here this figure mainly shows Nueces, but some of the other counties in the coastal bend. Over the last 4 weeks, and this is a 4-week period here, there's a net downwards trend in Nueces County in new cases per day. But if you look over the last week, there does appear to be a slight increase. So we'll keep following this and see if this is just variation. It's going to start going down again, or if this is the beginning of a new trend. Zooming in on the other counties, what we do is we split them up between categories of increasing, which no counties show an increasing pattern this week, no trend, or decreasing. Again, this is over a 4-week period, and we have an algorithm pick out which of these are increasing, decreasing, or show no trend. And while some of them look like, well, it looks like there's a trend there, like with Clayburgh, the algorithm's saying no, it's not a statistically significant trend. And there's no trend there. So San Patricio, Clayburgh, Aransas, and McMullen are in the no trend category, and Jim Wells, B, Duval, Brooks, Kennedy, Refugio, and Live Oak are in the decreasing trend category. Most of them slightly decreasing over the past 4 weeks. And just like with Nueces, in the last couple weeks there may be a different pattern. Like in Aransas County over the last 2 weeks, it looks like there's an increase in the number of new cases per day. Unlike Jim Wells, where in the last week there's a decrease. Zooming out to the metro areas of South Texas, we can see that Laredo indeed peaked and is on its way back down. And most of the other counties have peaked also, or are about to peak, like McAllen here. The one exception is Aransas. When we zoom out and look at a longer time period than just the last month, we can see that there's a long-term trend of increase in Aransas County that seems to be continuing. So we're going to continue to watch this and keep you appraised. Hopefully this is about to peak and turn downwards like we see in the other counties. Okay, now zooming out to the whole state of Texas, and I want to start by talking about the public health region here in blue that includes Austin. Now, there was, in the database that we're downloading from the state, there were a large number of cases that were put in that Austin public health region that are either a data error or a backlog that are causing this spike to occur. We don't think that this spike is real, but we don't have any further information about that right now. I checked the newspapers. There's nothing in the newspapers about it, so presumably this is just a data error again, or a backlog of cases that were deposited in the last week. So this is not a real COVID spike as far as we know. Moving on, San Antonio looks like it's trending downwards, and if we go to the other public health regions, which encompass large swaths of Texas, you can see that most of them are going downwards or are peaking. And even with Austin, most likely it's going downwards. There's that data that we don't know what it means yet that has been put in there. It's causing it to look like a spike. And this is wrong. It's not rising, decreasing. I made an error here in this text. Okay, next. COVID inpatients are decreasing. Again, the black points are the number of people with COVID in the hospital in the Coastal Bend each day. If one person is in the hospital for 2 days in a row, then they get counted on each of those days. This is the total number of people that are in the hospital on those days. And the colors represent our projections with the model fit to the data, and then projecting out with our upper and lower transmission rates. So it looks like the number of COVID inpatients is going to continue to decrease for the foreseeable future. A metric that we're really tracking is this percent of staffed beds that have COVID patients in them. Right now we're at 12.6%. And we're trending downwards away from the 15% threshold. That 15% threshold signifies the tipping point between having businesses stay at their present occupancy or rolling back to 50% occupancy. We don't foresee any rollbacks or going above 15% in the next week at the very least. In terms of patients in the ICU, this week or right now on February 3rd, which is a couple days ago, this data is slightly lagged. There are 59 people in the ICU with COVID, 135 without COVID, and 194 total. We can see is that this is leveling off. I would say over the last week or two, it's really been level with not much change at all in the number of COVID patients in the ICU. Zooming out to the whole state of Texas on just February 3rd, this is just like the last figure where red represents COVID and blue represents non-COVID patients in the ICU. And what we can see is that the stress level on the ICU is declining. So we did have before the Coastal Bend, Lubbock, and Galveston having relatively low levels, but now there's additional portions of Texas that are seeing declining stress on their ICUs from COVID, including College Station, Belton, Killeen, and Abilene region. Moving on to this figure is very similar to the last figure, except it has all the days for the past several months, so you can see trends in how the pressure on the ICU is changing due to COVID. And if you want to pause the video to inspect these graphs, now's the time. Overall, if you summarize them, it looks like there's a general downwards trend across all of Texas. Moving forward. So we go in this order because that's the order that the disease progresses in. People get infected, then maybe a week later they test positive after getting that infection, and then after that some people need to go to the hospital, and unfortunately some people end up dying from COVID. It's one of the reasons why this is such a big deal, right? And so in terms of new fatalities per day in the Coastal Bend, that's each of these dots, we were increasing, but we're right at the peak. And it looks like moving forward, we're going to start to decrease in terms of new fatalities per day. So fatalities have been rising and it's peaking, and then hopefully in the future, we're going to see these start to decline. Okay, and that brings us to our total number of fatalities, where we've eclipsed the 1,000 mark with more than 1,030 fatalities in the Coastal Bend at this point. These are fatalities that are being recorded by the state. They inspect each death certificate and count the death certificates where COVID is the primary cause of death. We have In Nueces County, we get a daily report on the number of fatalities, and as of yesterday, we were at 658 fatalities for Nueces County alone. So it shows that about 400 of the fatalities are coming from the rest of the coastal bend, and again, showing that it's not just Nueces, but you could be in any county, regardless of how rural it is or out of the way. There's people that are dying from COVID. So in summary, the transmission rate is between 0.81 and 0.93. It's below 1. That means that maybe this fall-winter outbreak we've been in is subsiding, and we see that same pattern across all of Texas. New cases are declining, hospitalizations are declining, the fatalities are peaking and hopefully will start to decline. I want to remind everybody that you want to stay vigilant. This weekend is the Super Bowl, and that can be a time where we like to get together with friends and family and watch the Super Bowl and eat food and have fun, right? And this year for the Super Bowl, just like with Christmas, just like with Thanksgiving, just like with New Year's, it's not the year to have a huge Super Bowl party. We discourage multi-household celebrations. If you're not going to listen to this, at least take some precautions. You can have the Super Bowl celebration outside. I know that's pretty common in any year. If you have it inside, make sure that you open some windows and have lots of ventilation. Encourage masks when you're not drinking or eating, and generally try to obey the same rules that we've been recommending for the other holidays. In general, make sure that you're wearing your face coverings. Remember, doubling up is being recommended if you don't have an N95 or KN95. Social distance, and definitely get vaccinated if you're eligible for it. And the more people that get vaccinated, the closer we get to this being over. So that's the report for this week. I want to thank you for tuning in, and we will see you next week.